Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about the prevalence of hip bursitis in hockey players and a test that can be done to possibly determine if there is some hip bursitis occurring. But before I begin, please hit that subscribe button below. So hip bursitis is a very common injury for hockey players, and the reason for that is the action of skating. It implements lots of what's referred to as hip abduction, where essentially the hip goes out to the side. So when we're pushing off of the ice, you're going to be utilizing that movement fairly frequently. And ideally with that movement, what we're hoping from a biomechanical perspective is that the individual is properly using one of their glute muscles, in particular the glute med muscle, to do that action, and that they're not compensating by using other muscles. Now, when somebody does use other muscles, perhaps if there's weaknesses in the glute med muscle, that puts the individual at a greater risk of developing what's referred to as hip bursitis. And essentially what hip bursitis is, it's inflammation of one of the bursa that is situated along the side of the hip. And bursa, you can think of bursa as essentially sacs of fluid that help to lubricate the joint. You have bursa in all different joints of the body. You have bursa in your elbow, in your shoulder, in your knees, in your ankles, in your hips. And so its main job, as I said, is to help lubricate the joint. So the bursa along the side of the hip there, it is actually in very close contact to what's referred to as your IT band. And your IT band is basically a form of connective tissue which runs from the hip and it goes all the way down into the knee area. And so what'll sometimes happen is when that IT band, when it's really tight, it will actually irritate and rub on that bursa, and the bursa will then become inflamed. And so one of the main tests that we do for hip bursitis is called the straight leg raise test. And basically I'll have a patient balance on their affected side, and then I'll have them actually do a single leg squat movement. And what'll happen is when they're doing that particular action, this might recreate some of that rubbing action on the bursa and will cause pain. And so again, that's one of the tests that we would do in the clinic, along with several others, right? So it would be painful also just on palpation, so putting pressure into that area would cause some pain. And again, a few other tests we would use would be to determine if that glute med muscle is weak, and also if there's tightness in the IT band. But one of the, just sort of a simple practical test that can be done is that single leg squat test. Now, if that's found to be positive, our rehab process is going to be along the lines of trying to reduce the inflammation of that bursa, increase the flexibility of the IT band, and strengthen core muscles as well as the glute med muscle. If you have any specific questions or concerns, please feel free to leave a comment below, and have a great day. Take care.